Hello, everyone, and welcome. I'm very happy to be presenting today and talking about engaging in opioid use disorder stigma reduction and giving you a brief overview of some really excellent resources and ways to reduce stigma for the opioid crisis. My name is Dr. Ashley Yaugher, and I am a professional practice extension assistant professor in health and wellness at Utah State University Extension. I want to get us started with just a brief outline of what we're going to talk about. We're going to do a quick review of opioids and the opioid crisis so that we all know what we're talking about and having a framework of reference for what I'm discussing. We'll talk also next about stigma and do an overview of what stigma is, as well as talking about ways to combat stigma and using non-stigmatizing language as a specific example of a really evidence-based way to reduce stigma for the opioid use disorder crisis that we're facing. And then we'll talk briefly about some evidence-based opioid use disorder treatments and talk about those, as well as some key takeaways and things that you can really implement today after you've seen this presentation. And I also look forward to seeing and responding to any questions, comments that you might have, and really I'm available after the presentation as well. So just to talk briefly about what opioids are, they're a highly habit-forming class of chemicals used to reduce the intensity and feeling of pain. There's some common examples. A lot of these are prescription medications, so things like oxycodone, codeine, morphine, Vicodin, Percocet, fentanyl. There's also synthetic fentanyl and heroin that people use illicitly, as well as misusing some of these prescription medications. So by misuse, when I say that, I mean they use either more or more often than directed by their prescription and their doctor, or they're using without a prescription. And 80% of people who use heroin first misuse a opioid prescription that they receive from their doctor. And so that's something that we just really want to hit home today in talking about why we're concerned with this, because you can see the majority of people who have misused opiates in the past year have been people who are using opioid pain relievers. And so that you can see on this chart here, this graph, very few people are using exclusively heroin, that illicit substance. And when I'm talking about substance use disorders, including opioid use disorder, I'm talking about treatable mental health conditions in which there's a pattern of substance use that leads to impairment, distress in their social, occupational, and or familial settings. So that's something that we'll talk briefly about as well as we move forward. I just wanted us all to have the same definitions. And again, most people, you can see the red arrow now pointing to that blue circle, misuse just opioid pain relievers, so that prescription medication. The opioid crisis, when we talk about this, you've probably heard it a lot in the past several years, but this is actually not our first opioid crisis. We started opioid crises back way back long ago when our medical providers were telling us that there was no danger in using opioids and that they were safe to prescribe and there was no issue in prescribing opioid medication. However, that was a misinterpretation of the evidence and is not the case, because we now know the highly habit-forming effects of opioids and the complications that come with that. And with the opioid crisis, I just wanted to give you a few simple facts that you can take from our presentation today. About 1.6 million people experienced opioid use disorder in 2019. This is data from SAMHSA, so you can also go and look up any of this information that I'm talking about and kind of take a deeper dive if you're interested. And of those people in substance use disorder treatment overall, so not just people with opioid use disorder, only 12%, that's about 1 in 10 people who need substance use disorder treatment are getting their treatment, and that was in 2019. And as going along with our opioid crisis data, about 841,000 people die from overdose. Since 1999, we've lost a lot of lives, and that equates to, in recent years, twice as many people dying from substance-related overdoses than car accidents, and that's a really staggering statistic if we think about it. and that's about 71,000 deaths in 2019, over 2/3 of which have been opioid related, and about 185 deaths a day, if we're thinking about it in that way. And something else that we wanted to just briefly mention is that people are receiving these medications and opioids, right? If you look at this chart here, you can see where they're getting their medications from. And you can see, I'm gonna have a little red line show up right here. Most people, over 50%, get prescription medication either given to them or from a loved one's cabinet. So this is something that we're going to talk about towards the end, but it's really important, even though sometimes people have the best of intentions of sharing their old medications or might not even know they're in their cabinets. We just had a national DEA Take Back Day. It's really important to put your medications and get rid of them to a authorized drop box location whenever you're done with them, and don't hold on to your old or unused medications, and don't share them with a loved one. So you can see on this chart, most people do get those medications from loved ones, friends, family members. And then talking a little bit about the opioid overdose crisis, you can see deaths in each state here. This is per 100,000 people, and you can just see it's kind of a heat map. So the lighter color indicates fewer people per 100,000, and the darker color to green indicates more people per 100,000. And you can see some regional sort of differences throughout the United States. And looking closer at opioid-specific overdoses, you can see, again, these percentages of those substance use overdoses that you can see going from, again, lighter to darker, like a heat map, how many of those involved opioids. And here you can really see some regional differences and how many of those deaths involved opioids. And that's a staggering number. So this is just something I wanted to show and just give you an idea of how many of those deaths are a result of opioids. And one of the big pieces of the opioid crisis is stigma. And when I have done word cloud activities, this is an example of one I've done in the past, these are things that people say come to mind when they hear the word stigma. So things like snap, judgment, prejudice, something that's negative, bias. These are some of those quick words that come to mind when you're thinking of stigma, and it encompasses all of those things. And when we're thinking about stigma, we can talk about it in a way that we're referring to a group of people, often including different public policies that are directed at that group of people. And we break it down into three main categories typically. That's social stigma, structural stigma, and self-stigma. Social stigma is at groups and boosting stereotypes of those individuals. Structural stigma is negative attitudes and behaviors that represent larger groups, so kind of that structural basis. And self-stigma is when people actually internalize these negative views and hold them towards themselves. And I like this quote at the bottom, that stigma is being reduced from a whole and usual person to a tainted, discounted one. Because that is what stigma serves to do for people. And it can be a really big barrier for individuals with substance use disorder and opioid use disorder to getting the treatment that they need and that they can use to engage in recovery. And here's some example of how stigma increases harm. It can cause fear, prejudice, discrimination. It reduces their quality of health care and can really play a role there in them even seeking health care. It can have negative impacts on their self, their hope. It increases the likelihood of return to substance use and lower rates of recovery. And it's a very destructive cycle for people. You can see in this cycle, it starts with public stigma and goes to discrimination, fear, prejudice, and that damages someone's self-esteem and their likelihood of seeking treatment, which then in turn increases self-stigma, shame, and doubt, and reduced rates of recovery, dropping out of treatment, and that might trigger a return to substance use and some of those other negative consequences that stigma causes. When we're talking specifically about opioid use disorder stigma and how to start reducing that, now that we've talked about some of the major components, we talk about 4 evidence-based ways to reduce stigma. And the first one is basing things on education and real life stories. Research has shown that if we enhance education about people with opioid use disorder, we can really reduce some of that stigma, and people can learn that opioid use disorder is a treatable medical condition and that people do recover. And that is something that's really great and something that we can share, as well as real life stories of people, because education alone and fact sheets and just giving people a lot of information by itself is not enough to actually change or reduce stigma. So something that comes with that education is applying some real life stories and education with that. Also, these stories, we want them to be positive and people to have positive interactions with people in recovery. That can really help improve the attitude of the general public, that social stigma. And using non-stigmatizing language in these examples and these stories can be really helpful, one, to model this skill, but also to help people understand and feel comfortable and safe in an environment where they're talking about recovery or their experience with substance use disorder. And something like that can really change people's path to recovery and help them where they are. If they're not in recovery yet, it can lay the framework and the foundation for them seeking recovery in the future. And so that's something really important to talk about, and we'll talk about that on the next slide as well. The next thing here for opioid use disorder stigma reduction, if we're talking about self-stigma, something that's really effective are things like acceptance and commitment therapy groups and job training. This counseling and vocational training can help reduce self-stigma and really encourage or support an individual's recovery, because they learn to see themselves as a whole person. And these different trainings can improve their self-concept and really bolster their recovery efforts, because that they are valued and supported. And lastly, just as a few examples, this is a shortened list. There are more examples of opioid use disorder stigma reduction, but these are some of the big ones. And these strategies can be really helpful if we really focus on empathy and compassion, changing our narratives that we say and talking about people who are in recovery or people with opioid use disorder, and changing that with reducing our stigma through acceptance and mindfulness and awareness of the way that we are speaking is really, really helpful, including just simple phrases and things that people say often but can harm someone's recovery and their efforts. And so as a quick example, I'd like to just give some common non-stigmatizing replacements for language and just hit home that what we say really, really matters in our treatment settings, in our settings with people in public health, and in your family and home settings as well. Because if we can talk to people as humans first, then we can start to change the stigma and help people find the resources when they're ready and help them to maintain their recovery. So one quick example that I hear often and is kind of the most common is changing from addict or addiction and dirty to a person with a substance use disorder, or a person who tests positive for substances, if we're talking about testing and those types of things. So again, if you notice, this person first language, you put the person first. So you say a person with substance use disorder, a person with opioid use disorder. Former addict, getting clean, right? Those are another example of some stigmatizing phrases that people often use. And instead you would say a person in recovery, or someone who is testing negative for substances. Clean, sober, right? A lot of times we have these negative association words that come with it, implying that someone with opioid use disorder or substance use disorder is dirty or immoral or something like that. And we can really shift our language to saying substance-free. Treatment is the goal. It doesn't sound stigmatizing at the onset, right? But honestly, we can shift our language to say treatment is one path to recovery. Not every person wants to or can engage in treatment. So it is one path, and recovery does not look the same for all people. There's not one size fits all for a recovery path. So that's something that's really important to remember as well. And opioid replacement or opioid management, we don't like to use those words. We would focus more on medication-assisted treatment or medication for opioid use disorder, MOUD or MAT. are some common phrases that are non-stigmatizing. And lastly, one that is used often is relapse, and that can be really stigmatizing to people who are in recovery. So what we would say instead, and kind of framing this to people, would say recurrence or return to substance use. So replacing some of those common phrases that we've heard over and over again to phrases that are more person first and compassionate and empathetic to encourage recovery and reduce stigma. And it's okay if we've made these mistakes in the past. Our goal is to recognize and be mindful and shift them in the future and start to show people that we can change this language. It's definitely possible. The next piece that I wanted to talk about specifically is evidence-based treatment. So treatment does work, it's effective, it's evidence-based, and recovery is possible. Treatment works best when you have a whole person approach that includes the biopsychosocial model. So that includes things like biological backgrounds, injuries, genetics, those type of things, psychological histories, so any triggers, coping skills, where people are at right now, past traumas, and then social settings and social things like family life and communities that they're in, peers. And these all have interactions that are very complex. There's not one single thing or aspect of a person that causes a substance use disorder. It's not a simple issue. There's all these things that are interactive. So when we're talking about treatment and recovery, we want to make sure that we're talking about a whole person, because that is what's most effective. And some specific examples of some evidence-based treatment models include cognitive behavioral therapy that focuses on thoughts, behaviors, and feelings, and increasing coping skills and replacing some of those negative thoughts or things that are no longer serving the person with more adaptive skills. Motivational interviewing, which includes non-judgmental interviews and guiding the person and helping them to understand their own goals and motivations. Mindfulness-based stress reduction, or MBSR, which includes mindfulness and awareness and helping the person to identify triggers and engaging in healthy coping skills in those moments. And lastly, just on our quick list of examples here, this is not an exhaustive list, is acceptance and commitment therapy, or ACT. And that is really values-based and focuses on a lot of mindfulness and being present in the moment and using skills and replacing some of those skills that are healthy with things that you can use in the moment and not using the unhealthy skills or things that you have used in the past for coping, such as substances. Again, briefly talking about MOUD, medications for opioid use disorder. When you combine these with behavioral counseling and some of those evidence-based treatments that I mentioned for a whole patient approach, it reduces opioid overdose deaths substantially. It's evidence-based, and it's very important for people to get into those treatments if it's something that they would like to do. So stigma reduction is one way that we can encourage recovery and effective evidence-based treatment, and talking about medications for opioid use disorder is another way that we can help people to understand these evidence-based treatments for individuals with opioid use disorder as well, and talking about them in ways that we can really increase their acceptance and use, because they are one of our harm reduction tools and evidence-based ways for treating opioid use disorder, including things like methadone, buprenorphine, or Suboxone, and naltrexone. And so I'm just going to continue on and talking about, and also Vivitrol with that. So talking about some key takeaways here after we've reviewed the opioid crisis, stigma, and how to reduce it, and then some evidence-based treatments for opioid use disorder. I think it really shows that we are all in this together. It is very common for people to start taking opioid medications, and I know several people who have had babies and been prescribed opioid medications after their C-sections, and they continue to take those medications even though they may or may not need them, but their doctor prescribed them, so they're going to take them because they were under the impression that they just keep taking them, and that's something that they're supposed to do until they're gone. And after about 5 to 7 days, people can become dependent on their opioid medications. And so we're really all in this together, from moms, doctors, right? Everybody can play a role in preventing opioid use disorder from yourself, from others, medical providers. Each of us has a role to play in reducing opioid use disorder and stigma. And I want you to think just one thing that you can do, and I have a few examples of some things that you can do today after this presentation, some action items for you, and thinking about that mom or that person who you know, that loved one, that child who broke their arm and is exposed to opioids. What are some things that we can do? We can really focus on prevention. So if you don't need an opioid medication, don't take one. Talk to your doctor, and if you are a medical provider, talk to your patients about their past risk factors. Are they somebody with a substance use disorder? Maybe an opioid medication is not right for them, where some other type of medication would be right, or doing some type of alternative pain management therapy. So things like cognitive behavioral therapy are really effective for managing pain, or mindfulness-based interventions. So not taking opioids is one factor in reducing that risk. So is medication disposal. And I mentioned at the beginning that 50% of people who misuse opioid medications get them from a loved one. So getting those medications out of your house and into the correct drop boxes is really important. We can also talk about harm reduction as something that you can discuss and do today, right? So reducing those undesirable consequences to make a path for when people are ready for recovery. So things like naloxone, where if somebody has an overdose, naloxone can reverse the effects of that overdose temporarily. So something that's really important is to provide and to have on hand naloxone or Narcan for people who do get opioid prescriptions or who are using illicit opiates. Like heroin or fentanyl, because when people survive, they do go into recovery, and you can't recover if you overdose and you are not revived. So that's something that's really important that I want to hit home, is that harm reduction is another evidence-based way to help support people into recovery. And then treatment and recovery, like I mentioned, there's no one-stop shop. It takes a lot of time. Something you can do today is reaching out to a loved one or somebody that you care about, saying, hey, how's it going? Checking in, offering to take them to an appointment, or giving them resources. And I have a list of national resources coming up towards the end here that can help get you started in finding resources to provide to a loved one and offering them that support and help when they're ready on their path to recovery. And finally, something that seems simple but makes a really big difference is sharing, teaching others about what you've learned today about stigma reduction and evidence-based treatment. One example of that is the Stories of Utah's Opioid Crisis. We have some wonderful qualitative interviews that are all housed online that you're welcome to search and listen to, that talk a lot about recovery and hope and how people found that pathway specifically in Utah. So we'd love to have people look at that. And other national opioid use disorder resources, these are some common lists of places that I like to send people to just get an idea of, okay, I have a loved one who needs support. Where can I send them? The American Psychological Association, or APA, has a lot of great substance use related resources. So if you click or search that link, that would be a wonderful place to start. The CDC also has a lot of really wonderful information on opioids, including research, current statistics, and also recovery and treatment resources for you. So if you go to cdc.gov, you can find that on their opioids page. And then the National Alliance on Mental Illness, or NAMI, you can go there and look about mental illness and other mental health disorders, including substance use disorders, and they have a lot of information there for substance use related disorders. And then National Institute on Drug Abuse, or NIDA, has some good information on that topic, and you can look there as well. And then SAMHSA, the Substance Abuse and Mental Health Services Administration, has a wonderful treatment locator that you can direct people to, as well as an opioid overdose prevention toolkit if you wanted to look into, well, how do I start implementing some of these things into my community? What can I do? And so that's a really great place to start if you're wanting to get more involved with opioid use disorder prevention, treatment, and recovery. I would like to say thank you and encourage you to reach out if you have future questions, concerns, or would like more resources, I'm happy to provide those. You can also follow us. The Health Extension Advocacy and Research and Teaching Initiative, also known as HEART, at Utah State University Extension, is explicitly focused on opioids, and you can follow our social media here to stay connected. We also have a YouTube channel where we post some general health and wellness information as well as opioid-related information. And just to show you very quickly, we have some select references and resources that you are welcome to look at in the future after this recorded presentation. And I, again, want to say thank you for your time in learning about opioid use disorder and stigma reduction. We each have a part to play in reducing the opioid crisis, and stigma reduction is one way in which we can encourage evidence-based treatment, prevention, recovery, and put an end to this crisis and treat people like people. Treatment works and recovery is possible. Thank you.